another finding, another thing I want to talk about. There's a lot of loss involved with PAS. You know, there's the obvious loss. A parent loses a child, and that's, you know, short of the death of a child, this is the worst thing that can happen to a parent. You know, these parents live in a constant state of yearning, a constant state of disappointment and pain and suffering. They don't get to go through the 7 stages of grieving that they finally come to acceptance, right? They live in sort of a suspended animation. And of course, the child loses a parent, and that is a terrible thing to do to a child, and I'm going to talk about that a little bit later. And of course, the child loses relationships with the whole extended family, and all of those people lose relationships. You know, I get phone calls from aunts and uncles and grandparents. Their heart's broken too. You know, they've invested, they love this child, they've seen this baby grow, and all of a sudden, you know, this 7-year-old or 10-year-old is saying, you know, I can't even be bothered to come to your wedding or funeral or this event or that event. I mean, it's horrible. But there's another loss too. The child loses a piece of him or herself. Okay, and my new pithy thing is, to turn a child against a parent is to turn a child against himself. All right? The child who's alienated has to cut off all the good memories they have of the targeted parent, because they're in there. If there was, in fact, good memories, good snuggles and watching movies and cavorting on the beach and whatever, that has to be buried. Any doubt the child has about the intentions of the alienating parent, like, why is mom having such a hard time? That has to get denied too. Any way in which they are like the targeted parent, whether it's that they look like that parent or they have the same sensibility of that parent, they're grumpy in the morning, whatever it is, they have to cut off that piece of themselves. And you know, I was giving this talk, and at this point in the talk, somebody in the audience said, you know, I just realized, just this minute, I'm an adult child of parental alienation. And he told the story that he had an Irish mother who was the alienating parent and a Hispanic father who he was forbidden to have any contact with and any good feelings for. And he said, you know, my whole life I felt compelled to have plastic surgery to change my appearance, so I don't look Hispanic, and I never realized that it's because I didn't want to look like my father. And one of the young people a young woman that I interviewed, when her mother was mad at her, the mother, again in this case was the alienating parent, said, oh, you have those big sticking out ears just like your father. And you know what this girl did when she was a young girl? She glued her ears to her head because she couldn't tolerate being like her father, because to be like her father meant to be hated by her mother, and then she'd have nobody. All right, so this is a terrible thing to do to a child. There's many, many, many levels of loss. And you know, in my research, one of the things that I found was that sometimes before there's the reconciliation with the targeted parent, there has to be a reunion with the self. The child has to get back in touch with the parts of him or herself that he's had to cut off. He has to be able to admit, gee, maybe I shouldn't have cut off that parent. Maybe that parent's not so bad. Maybe that was a mistake. I want to talk a little bit about cults. I've sort of indicated that there's this analogy. Chapter 2 of my book is called The Cult of Parenthood. This is almost a spot-on, perfect analogy that alienating parents create a cult-like atmosphere. They use the same strategies that cult leaders use. I don't think they're reading books on how to be a cult leader. I think they just know intuitively how to emotionally manipulate their children, how to create dependency on them. That's the core of being in a cult, is you give all your, you give up your self-sufficiency, your independent thinking, your critical thinking, and you become wholly dependent on this other person, even when it goes against your own best interest, right? Every time? I have to do this twice? Okay. The cult analogy is useful because the people that I interviewed felt like, gee, I'm the only person in the world who was so stupid, you know, to walk away from my loving dad and just because my horrible abusive mom told me to, right? And they had no way of talking about it. Now, hopefully with this conference, and maybe we'll get the word out about parental alienation, but until it's widely talked about, the cult analogy helps people understand. You know, and one of the things I say, I don't know if you read the Star newspaper article, but I gave this quote in there, you know, no adult wakes up and says, today's the day. I've just decided I'm going to shave my head. I'm going to give away all my money. I'm going to cut off my friends and family and quit my job, move out of my home. I'm going to move into a commune. I'll probably not eat enough or get enough sleep, and I really want to stand in an airport for 15 hours a day selling flowers for nickels so some stranger can have a Mercedes. That's my life plan, right? Nobody says that, and yet it happens, right? Because the person's critical thinking skills are slowly eroded. Well, if it can happen to an adult who's going against their own best interest for a total stranger, it can certainly happen for a child with their own parent. And when you talk to alienated kids, it helps them understand how they made this decision, right? Because many, many, many people end up in cult.
Sorry, Dr. Baker, can you clarify a point you made last night, which I thought was, it seemed to be a very startling realization, and it was the difference between the classification of a real abused child and I'm not sure how to
The concept of the differential diagnosis? Okay. Well, the concept of a differential diagnosis is you're looking at the presentation. This is sort of from the perspective of a clinician and a judge. You have a child in front of you who says, you know, I hate this parent. Let's say mom is the targeted parent. I hate mom. I never want to see her again. She's a horrible, horrible person. I love dad. He's the best, and I want to be only with him. So your job is to try to differentiate, is this child's rejection due to legitimate fear of that parent? Is that an abusive parent and the child is realistically responding to that and doesn't want a relationship with the parent for that reason? Or an alternative explanation is that the child's rejection of that parent is being engineered by the other parent. So those are just two plausible alternative explanations. It's either abuse or it's parental alienation, and the way that you can determine the difference is by looking at the pattern of behavior of the child, because kids who have been abused and are rejecting an abusive parent typically do not present with those 8 behavioral manifestations: the campaign of denigration, the weak, frivolous, absurd reasons, the borrowed scenarios, the absolute black-white thinking of worshiping one parent and demonizing the other. Kids who have been legitimately abused do not proudly, widely proclaim to the universe, you know, my parent abused me and yay, I want to talk about it all the time. They have very, very different clinical presentations.